Is it possible that a woman could see 4 different doctors and have her diagnosis missed 4 times, even though she was practically screaming her diagnosis at each of her providers? And is it possible that a woman who was really doing her best to get the medical care that she needed lost out on maybe 5 to 7 years of her life because not one of these individuals was able to figure out what was going on? My name is Scott Resnick, and I'm a medical doctor, and I'm making these videos to bring complex subjects into the light so you can turn around your health without using conventional drugs. And today we're talking about thyroid. So I want to introduce you to my patient, Kathy. She's a 43-year-old woman. She's got 2 kids. She's got a small business at home that she works really hard on. She's got a good marriage, but what she's noticed that over the last several years that things aren't quite right. I mean, her weight has been creeping up. Her mood is off. She doesn't feel as pretty or as healthy as she's been in the past. So she goes to her primary care doctor, and dutifully he checks a blood count and a chemistry, and for some crazy reason, a cholesterol panel. And guess what? She's told everything was normal, including her TSH of 3, because as we know, a normal range of TSH, which stands for thyroid stimulating hormone, is between 0.5 and 5, and if your TSH is 3, that's normal, right? So her primary care doctor sent her to some specialists, and he first sent her to a dermatologist. She met with the dermatologist and said, my hair and my skin are so dry, my nails are cracking, things really feel off. I'm having dandruff. I've never had that happen before in my life. And the dermatologist put her on a number of special shampoos and creams and lotions, and she didn't get better. She went back to her primary care doctor, who then sent her to a psychiatrist for her depression symptoms. And the psychiatrist recommended putting her on an antidepressant, but she had been on an antidepressant in the past and she didn't like how she felt. She felt that that wasn't her problem, that there was something organic, something biological going on with her. She went back to her primary care doc and said, no, your TSH of 3 is fine. Let's get you to go see a gastroenterologist for the belly pain and the constipation that you've been struggling with. And the GI doctor wanted to do a scope from above and a scope from below, but she declined that and she came to speak to me. And after taking her history, as you can probably tell by now, I was hearing that she was in a hypothyroid state. Now, the important thing to remember is that there are a lot of doctors who just measure a TSH, but this isn't telling you what's going on in terms of the active thyroid hormones at the cellular level. So we did the full thyroid panel, which was the TSH and a free T3 and a free T4 and a reverse T3, and I also looked for the anti-Hashimoto's antibodies. And as it turns out, she was in a pretty significantly hypothyroid state in spite of a TSH of 3, which would be right in the middle of most labs' normal range. The difference is that we looked at the free hormones and just didn't rely on the TSH to assess her state of hypothyroidism, because basically she was screaming, I am hypothyroid, to all of her doctors, and they didn't hear or they didn't listen. So now let's fast forward about 3 or 4 months. What we did is we worked on her stress response. We worked on some of her nutritional markers that I can go over in another video. But what happened was that we used some thyroid hormone to get her free hormones up into the upper half of their normal range. And guess what? Her life changed. Her hair and her skin started feeling luxurious and soft again. Her mood improved dramatically, and her bowel function improved as well. She went back to having 1 or 2 bowel movements every day. So basically, by addressing the thyroid hormone dysfunction correctly, we changed her life. Now, if you guys know somebody who would benefit by this information, I would like you to share this video, because we need to get people out there understanding that just measuring a TSH ain't going to do it for knowing what's going on with your thyroid health. And if you guys want to know where you stand on this disease to health spectrum, I've done a really simple at-home 5-question self-analysis that's going to let you know where you are on this wellness to disease pathway, because when you know where you start, then you can know what you need to do. As always, I'm making these videos for you. I hope to see you guys in another video, and take care.